Hello everybody, this is a lecture on Module 4.2. I'm covering items A through F under number 2 on your Need to Know sheet. Please remember to take notes and that you can pause anytime and come back to this later. There's a lot of information here. So please follow along with your Need to Know pages for Module 4 Neurolinguistics. In this lecture I'm going to cover a lot of technical terms, and then I'm going to talk about Broca's and Wernicke's areas and about aphasia. First, some technical terms. Cerebrum is the term for the brain, just the entire brain, the neurons, which are the nerve cells, and they're the outermost layer of the brain, and the connecting fiber bundles that lie underneath. The entire thing is called cerebrum. Cortex means rind or shell in Latin, and it's the outer layer of the brain. It's what we're used to looking at, and what you see here in this image with the dark shading as a background. The outer wrinkly layer of the brain is called the cortex, so it's the shell, the outside of the brain. It is totally packed with neurons, with nerve cells. All our higher cognitive functioning takes place right there. Our language, our hearing, our memory, our personality, our logical thinking, our emotions, our decision making, everything takes place in the cortex. The brain is divided into two halves, and they're called the cerebral hemispheres. Cerebral is the adjective of cerebrum. So cerebrum is the brain, cerebral means brain related. So there are two cerebral hemispheres, the two brain halves, the left and the right hemisphere. Here is what's interesting. The two of them are not connected to one another. They are two separate units. The brain is a paired organ like the lungs or the kidneys. So the two brain halves themselves are not connected to one another, but they sit atop of a major fiber bundle that is called the corpus callosum. You have that on the right hand side at the bottom of the screen. So the corpus callosum is this big fiber bundle that runs underneath the two brain halves and connects them to one another. And when they exchange information with one another, which is all the time, they send messages back and forth very, very fast via that corpus callosum. In the very back of the brain sits the cerebellum, which is the hindbrain. Cerebellum means little brain. Please look at that image on top with the dark shading. You see that there is a very different looking structure underneath and in the to one side. This is the cerebellum. The cerebellum looks very different, but is part of the whole cerebrum, and it is theorized to be the ancient part of the brain in evolutionary terms, that we started out with the cerebellum and then we grew the bigger brain, the modern cortex. Okay, so the cerebellum is interesting for us because it allows us to tell easily whether we're looking at the right or the left hemisphere, because it's underneath and the back. So it's really at the bottom of your skull, behind your back. So in this image here, we're looking at a right hemisphere, and we can tell easily because the cerebellum is underneath and in the back. Okay, a little bit more on the cerebellum, which means little brain in Latin. It's also called the hindbrain in English, and you have it here in this orange shading in this model of the brain. And this tells you that we're looking at the left hemisphere here, because you can always tell the cerebellum is underneath and in the back. The cerebellum does not, as far as we know now, contain higher cognitive functioning such as memory, emotions, decision-making, language, and so on. But it contains such functions that basically keep us alive. It has our reflexes. It makes us pull our hand away really fast if we burn our fingers. It makes us catch ourselves before we fall down when we trip. It has our wake and sleep cycles. It has our blood pressure, our breathing, these kind of things. Here's another image of a real brain, and we're looking at the brain from behind, and you see the wrinkled up cortex of the left and the right hemisphere. Underneath you see the cerebellum. Looks structurally very different. And then what you see nicely here is the brainstem. The brainstem is the connection between the brain and the spinal cord. So the brainstem connects the brain to the spinal cord. On the side here you see the corpus callosum. So this big fiber bundle is shaded in purple in this image here. So it's a huge fiber bundle that sits underneath the two hemispheres. It sits underneath the left and the right hemispheres, big fiber bundle, and lets them communicate with one another. Okay, Now we come to Paul Broca. Paul Broca was a physician who worked in France in the 1860s, and he had a special interest in patients who had lost language ability as the result of brain injury. He had a very, very famous case, and he reported about this case in 1861. People had known about brain injury and language problems long before, but he was able, because he worked in a huge hospital, and was able to do autopsies on many patients whom he had examined earlier. So he was able to gather a lot of information and do a real scientific presentation in 1861. Excuse me. So he had this patient, and this patient was named Tan for the longest time. Just recently, some documents have revealed that the name of the patient was Monsieur Le Born. So I have the name here underneath the brain, which is kind of a little bit odd. Also, I want to tell you at the bottom of the page here, I have a link that I like to follow myself. It goes to McGill University in Canada. They have a page called The Brain from Top to Bottom, and they have really nice accessible information about all kinds of things that are related to the brain. Okay, so Paul Broca has this patient, and he follows this patient's development for quite a while and works with him, Monsieur Le Born. And Monsieur Le Born suffered a stroke, and as a result of the stroke, he had a brain lesion. Monsieur Le Born could not speak anymore. The only thing he said was tan, and usually he said it twice, tan, tan. So you would talk to him and he would answer tan, 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 tan. And that was pretty much all you could get out of him. His comprehension was fine though. So Paul Broca could say, please come on in and sit down. Would you like to have a cup of tea, a cup of coffee? And Tan could answer by nodding or shaking his head. He could follow commands, come in, close the door, sit down, these kind of things. His comprehension was fine for the most part, but he could not express himself anymore. When Tan died, Broca got permission to perform an autopsy, and he took the brain. And so here's the image of the brain, and by the way, a university in Paris still owns that brain, which is a little bit disgusting to think about. And you can see that we're looking at the left hemisphere, but because you see that the cerebellum is structurally very different, and it's underneath and in the back. And you see where the damage is. So when a stroke happens, that means that for a while, blood supply to the brain is disrupted. And if that doesn't resume really fast, then the brain cells that are deprived of blood, they die off. So literally, they need nutrients and oxygen that is brought to them by the blood. And if they don't get that, the brain cells die, literally. The brain then has a way of flushing out the dead material. So these materials are dead, and they are rotting away. Sorry to gross you out. And then they get flushed out by the kidney, which is our body's cleansing system, as you know. And so once these dead cells are flushed out, then there is literally a hole. The amazing thing is that the brain is really very tough, and a person can suffer various strokes and have in the end a brain that looks a little bit like a Swiss cheese and continue living unless the brain suffers a major stroke that takes out most of its functioning. The brain will go on living with whatever deficits result from the lesions. So that's why you see a hole here in Tan's brain. So Paul Broca had also examined other brains, and what he was able to show was localization. And localization is the important idea that certain tasks in the brain take place in certain locales, in certain spots. It was for the longest time thought that the brain is a general problem-solving machine, and whatever you do, the entire brain is in on it. Up to a point, that is true. However, very specific tasks need specific locations to be carried out. In other words, if somebody suffers damage in the area that you see here, which is now called Broca's area in Broca's honor, if somebody suffers damage in Broca's area, they cannot talk anymore. Other than that, they are fine, which is surprising, but they just cannot speak anymore. So yes, you need more than this in order to really function with language, but without that area here, you cannot speak. So certain tasks, such as speech production, are localized. That was a sensation. The other thing that Paul Broca could show was that certain tasks, again, such as speech production, are lateralized. Lateralized means that they are that they are carried out either in the left or the right hemisphere. So Monsieur Le Born's right hemisphere was fine, not damaged at all. Only the left hemisphere was damaged, and that was a pattern that Broca saw with his other patients as well. So from this time on, we know that language is localized, meaning there are certain locations in the brain that you can pinpoint where language is carried out, although we really don't understand all of it yet, but that we know, that much we know. And language is lateralized. For the most part, it's in the left hemisphere. I'll talk to you about this later. Some people actually have Broca's area in the right hemisphere. And all of the people who have that are left-handers. There is an, as of yet, unexamined or not understood connection between your dominant hand and which side of your brain is likely to have language. The vast majority of the population is right-handed, and for those of us who are very right-handed, it's guaranteed that our Broca's area is in the left hemisphere. It's lateralized to the left, and most right-handers have it in the left as well. The only people who have ever been found to have had Broca's in the right hemisphere, they were left-handers, but not all left-handers. So there's something interesting going on here. Okay, more now about Broca and his discovery. So the term aphasia is used now, and by the way, I've heard it pronounced aphasia in Great Britain. So aphasia or aphasia is the term that refers to brain damage that happens to be in the language processing centers and that affects language production. So if somebody suffers damage in Broca's area, they will have aphasia for sure, and that means that they cannot do language properly anymore. Something important to keep in mind that when people suffer brain damage and that gives them aphasia, their normal intelligence remains intact. Imagine how frustrating that is. You're completely normal in your brain. You can think of everything and you want to talk, and all that comes out of your mouth is tan, 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 tan. That is super frustrating. Aphasia affects spoken and signed and written language. So Paul Broca's aphasiac patient, Tan, couldn't speak fluently anymore. People who use sign language as opposed to spoken language, they cannot sign fluently anymore, and written language is impossible as well. So whatever language task, whether it's signing language, speaking language, or writing language, you need Broca's area in order to do it. At the bottom of the screen, what I'm showing you here is the area that is now considered to be Broca's area, is areas 44 and 45. Those are Brodmann's areas. Brodmann was a German neuroscientist who started mapping brain regions, and this is over 100 years ago, but his system is still very much in use. So Brodmann areas are numbered, and scientists in all kinds of brain related fields refer to those areas by number. Okay, so Broca's aphasia, and I have this for you on your need to know page. Broca's aphasia is also called non-fluent aphasia, because if you have Broca's damage, you cannot speak fluently anymore. But good comprehension is typically retained. Another thing that happens in Broca's aphasia is agrammatism. Agrammatism means that you're going to mess up the grammar of your own language. I'll show you examples of that in a little bit. So generally there's good comprehension, but there is difficulties with complex constructions, for example with passives. If you tell a Broca's aphasiac, the cat was chased by the dog, it's a passive, meaning the dog did the chasing and the cat was being chased. They typically don't understand that, and they think the cat is chasing the dog. So yes, there is good comprehension, but there are still deficiencies, but nothing major. So by and large, they understand language. We know from people who do not have brain damage, when we study what the brain does as it listens to language, that Broca's area is active when we listen to language while we analyze the grammatical structure, not though when we analyze the sounds or the phonemes. That's another area that we'll get to in a moment. So I want to tell you, though, that our understanding of what exactly Broca's area does is not complete yet at all. It remains a very active field of research. I'm giving you an example here between an examiner, a medical examiner, and an aphasiac a person who has aphasia, and this is Broca's aphasia. So the examiner says, tell me, what did you do before you retired? And then with a lot of false starts and hesitations, the aphasic says, bartender, no. And the examiner, of course, has the file in front of him and in front of her and says, carpenter. And the aphasic patient shakes his head, yes, carpenter. 20 year. So here's what happens when people speak English and get Broca's aphasia. Plural endings go missing really, really fast. Look at that. He wants to say 20 years. He doesn't say years, and he will never ever use a plural anymore. It's just gone. So grammar mistakes, agrammatism, right? Mispronunciations. He wants to say carpenter. He knows what a carpenter is. He wants to say carpenter. It comes out as partender. And then finally he manages to say carpenter, but then he wants to say 20 and it doesn't come out. He tries tenty. Okay. Hesitations. Very often Broca's aphasiacs take forever if they can speak at all. Tan, Broca's original patient, could not say anything other than tan. Other people who don't have such very bad damage, they speak, but with a lot of hesitations. But you can see here also that there's good comprehension. The aphasic patient understood what he was asked. We'll be talking about Wernicke's aphasia in a moment, and that's loss of comprehension. So good comprehension is actually a blessing. I want to talk briefly about what it's like to deal with the diagnosis. If somebody suffers a stroke and as a result they have Broca's aphasia, medical staff can explain that to the patient, and because the patient retains good comprehension, they understand it. It is very frustrating and a terrible thing to have to deal with, that now you suddenly cannot express yourself fluently anymore, or not at all anymore. But at least if people explain it to you, you understand what's going on. When people have Wernicke's, they don't understand what they're being told. And that's a terrible situation to be in. So Broca's is the lesser of the two evils. Speech therapy is used, and it can be successful in letting people regain some of those abilities, or at least to cope better. I wanted to tell you that typically aphasia was the realm of older people, because most aphasia is the result of strokes. Basically, whatever hurts the brain can bring about damage to Broca's area in aphasia. Depressingly, the new cases of aphasia are young people. It's people who go to wars, like to Afghanistan, or sent off to Iraq or wherever else in the world the United States fights wars and has armed conflict. And if you are in a roadside bombing, it's possible that your brain gets hurt in Broca's area. And so the influx of new cases of aphasia are people in their 20s. It used to be the realm of really old people, and it's not anymore, which I find terribly depressing. But okay, let's go on. So in module 4.2 on etudes, I'm giving you 2 links to YouTube videos on Broca's aphasia. There is a very famous case of a young woman. She was a teenager when she suffered a stroke in Broca's area, and her mother and her name is Sarah Scott, they are chronicling her progress. It's very, very interesting. So there will be a link for you there. And the other link goes to somebody who is dubbed Tono Man, somebody who has Broca's damage as well, and all he can say is Tono and a few numbers. Now, no 2 cases of brain damage are identical. The severity of aphasia depends on the extent of damage and on other factors. So you will not find 2 people who have the exact same results of Broca's aphasia. Sarah doesn't have it as badly as Tono Man. Tono Man is not doing quite as badly as Tan, Broca's original patient. So no 2 cases are the same, and other factors are such, for example, the age of the person, the extent of medical training and medical help that they get, and physical therapy that they get, and speech therapy. So these things also play a role. Their attitudes also. Okay. Now we're going to Wernicke's aphasia. A German physician by the name of Karl Wernicke, and you guys can pronounce this however you want. Most Americans pronounce it Wernicke. So Karl Wernicke worked only 10 years after Broca, and he also studied, and they didn't actually know one another. Wernicke also studied cases of brain damage that led to language disorders, but his cases that he described were different. So he focused on a different situation. And Wernicke's aphasia is also called fluent aphasia. And has very poor comprehension. It's also called jargon aphasia. So here's what's happening, and I want you guys to now look at that image of a brain that has suffered Wernicke's aphasia. Every time I look at that, I cannot believe that the person who had suffered that lesion, that huge lesion, went on living, but they did. And so after they died, there was an autopsy, and this is the brain. More than Wernicke's area is wiped out here. And you guys see, though, that Broca's area is just fine. But Wernicke's area and other areas are wiped out. So here's what happens. People who have Wernicke's aphasia, they understand, they speak fluently. That's why it's called fluent aphasia. Their Broca's is fine. Broca's is the part of the brain that allows us to speak and to do grammar. So they speak fluently, their grammar is fine, but Wernicke's area knows what words mean. And so with that area gone, you cannot understand language anymore. They have poor comprehension or zero comprehension, depending on how bad the damage is. It's also called jargon aphasia because as they themselves speak, they make up words. And so for a while you think, oh, they must be speaking some jargon, some inside language that I don't happen to understand, when in fact it's made up and it's gibberish. Okay, I'd like to go over what's on my slide here. So Wernicke's aphasiacs, they hear language, their auditory cortex is intact, but language cannot be translated. It doesn't make sense to them anymore. So they hear it. We know that they can hear it and they react to it. But the part of their brain that decodes what language means is gone. They speak fluently and with good grammar and good pronunciation, but with little or no meaning, depending on just how bad that damage is. And so they speak fluently, and in their mind, they're making sense, but they don't. So jargon aphasia is made up words. I'll give you examples in a little bit. So the ability to match a word with its meaning is lost permanently. It's not just out of whack, but constantly changing. So for example, you could say book to them, and right now that means bicycle. But it's not enough for you to remember, oh, apparently when I say book, they understand bicycle. So every time I want to talk about a bicycle, I say the word book, if you follow my logic. It's not like that, because 5 minutes later, book could mean window. So it's completely up in the air. It's not like it's out of whack and they just call things by the wrong name, but if you keep track of it, then you can talk to them. No, it's gone for good. It's in flux. It's fluid. Pictures are fine, and remember, they have normal intelligence. Nowadays, people who have Wernicke's aphasia walk around with a tablet computer with huge picture files, and if they want to say bicycle, they look up that image on their tablet computer, and then they look at it, they show it to you, they tap at it, and they say here, 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 and you look at it, and it's a bicycle, and you say, oh, bicycle, and they say, yeah, window. You say, no, no, bicycle, and they say, yeah, yeah, book. So normal intelligence, complete inability to remember once and for all that one word refers to this object, just completely gone, depending on how bad the damage is. Okay, so I'm telling you what people ask me when I give this lecture in class, and there is a chance for questions. They ask me whether Wernicke's aphasiacs understand one another. They do not. So it's not like there is a rhyme or reason to that disorder. It is that there is an inability to come up with the correct name for things, and it's just gone. And so it's not like there is a secret code that Wernicke's aphasiacs can use with one another. They cannot read or write either. They know what objects are, but they cannot name them or comprehend their names, which is super frustrating. So for example, you could give them a comb, and then they know what comb is, and they would say, oh yeah, car, or oh yeah, tree, and it's a comb. Or they could make up a word for it that you have never heard. They could say, oh yeah, glib, and that means comb to them right now. In 5 minutes, it's going to mean something else. They can take the comb, they can comb their hair, they know exactly what it is. They cannot name it. And when you just say it to them without showing them the object, they don't know what you're talking about. Super, super frustrating. Okay, what Wernicke's is not. In the beginning, they thought Wernicke's is the location of the mental dictionary. It's not. So Wernicke's itself is not the location of the mental dictionary or the mental lexicon. Rather, Wernicke's area is the center that knows where in the brain vocabulary items are stashed away. So before you read on here, please listen to me. Turns out that we all have vocabulary stashed all over our brain, and it's probably not the same for any two people. So apparently the individual brain decides where to put words, and the words are clustered by topic. So we're literally walking around with some cluster somewhere in our brain for all the color terms, another cluster for all vegetables, another cluster somewhere for all plants or clothing or beverages, or you name it. So vocabulary items are clustered by topic, and they're in all kinds of different locations in the brain, and it doesn't seem to be the same for every one of us. So the individual brain gets to decide where to stash that stuff away, and only Wernicke's knows where it is. And so if Wernicke's is hurt, the brain keeps up looking up the wrong vocabulary. We know this because sometimes mild strokes in different areas of the brain can result in what is called selective anomia. So a mild stroke would be a tiny, tiny stroke that takes out the tiniest little bit of brain area of nerve cells, and it may be something that doesn't even bother you, and you never even notice that, or hardly ever. Just think about that. If a stroke should happen in the area of your brain where you process smell and taste, I mean, it would be tragic to have that happen, that you cannot taste and cannot smell anymore, but you can go on living just fine. Okay, so these mild strokes can result in anomia. Anomia is in H on your need to know, but I'm bringing up here. I'll tell you about it more later. So selective anomia means that only certain areas of vocabulary are wiped out. So it could happen that somebody has all color terms wiped out, just wiped out. So they are completely fine other than that, but they cannot remember the name for any one color. They have to talk around it. They might say, oh yeah, you know the one, it's the same color as this book here or something. So, okay, so I want to tell you also something that is not understood but just fascinating. When anomia hits, it typically wipes out nouns before it wipes out verbs. Why? Nobody knows. There's a famous case of a woman who has lost all the words for beverages. So she has selective anomia. She cannot remember the name for any beverage. So if she's really tired, she says, hey, everybody, I want to go over to Starbucks and have a cup of, and then somebody says coffee, and she says, yeah, that. And by the way, speech therapy would like to have these people relearn that, but it depends on the individual brain, on the age, on the therapy, on whatever else may be going on, whether people can relearn it or not. Most often not, which is surprising. Okay, so there's this woman who doesn't know beverages, and of course she doesn't know milk either. And milk as a noun is wiped out, but not as a verb. So you could show her a glass of milk and say, what is this? And she would say, this is a glass of, and now she talks around it, paraphrasing, saying, you know, comes from a cow, and you give it to children, it has calcium, it's really good for you, you have it with cookies, but she will not say milk. Then you show her an image of a farmer, and you say, what is this farmer doing? And she will say, oh, this farmer is milking the cow. You say, oh, yeah, and this is a glass of nothing. So the word is there as a verb, not as a noun. Go figure. Even more bizarre is when there is language selective anomia in bilinguals or multilinguals. There are people, actually, and the person I told you about a moment ago, who cannot remember color terms. She speaks Spanish and English. She's good with color terms in Spanish, but not good with color terms in English. They're gone. So that points towards bilinguals having different clusters of vocabulary coded by language. So bilinguals can look up the word in this language or in that language because Wernicke's has that stuff coded, so it knows. Okay, going on. Here's an example of what a Wernicke's aphasiac sounds like. And again, depending on how bad the damage is, it's different from patient to patient. So the examiner here says, do you like it here in Kansas City? And the aphasic answers, yes, I am. You can see there's already a problem. Either this came out wrong as they said it, or they misunderstood the question. Then the examiner says, I'd like to have you tell me something about your problem. And so here goes the aphasic patient. This is fluent aphasia, good grammar, good pronunciation. They speak very, very fluently, and they go fast. Whereas a Broca's aphasiac would take forever if they could answer at all. But at least they would know what they're saying. But look at this. This is not all that bad. So the person says, yeah, I can't heal all of my way. I can't talk all of the things I do. And part of the part I can go all right. But I can't tell from the other people. I usually most of my things. I know what can I talk, I know what they are, but I can't always come back even though I know they should be in. And I know should something eerily, I should know what I'm doing. And it goes on and on and on like that. And when you listen to somebody with Wernicke's aphasia, you think, oh yeah, I'm catching on, and then you lose them again, which is very frustrating for you and for them. So it seems to me that the patient here is trying to talk about his problem. This is a male patient as well. When he says, I can't talk all of the things. And when he says, I cannot tell from the other people. Right? But you guys see that there are two made up words. That would be the jargon. In the first line, he says, I can't hill all of my way. We have no idea what hill means to him right now. And in the second to last line, he says, something eerily. We have no idea what eerily means to this patient right now. In their mind, it means something, and they think everybody should understand it. So it's very frustrating. Okay, on Etudes, I have a link to a YouTube video on somebody who has Wernicke's aphasia, actually 2 patients. This is a very, very old recording, and I want to tell you that there's ethically, it's problematic. How can a Wernicke's aphasiac give informed consent to be recorded? The recordings that we have now on YouTube are either a sham, and I don't trust that they're right, or they're ethically wrong. And the ones that we have that I'm giving you a link to are of patients who must have long passed away. And they were recorded during a time when the medical profession didn't care about ethics as much as they do now, or at least let's hope that they do now. So somebody who doesn't understand language cannot give informed consent. I want to tell you again that no 2 cases of brain damage are identical, and the severity of aphasia, of Wernicke's and Broca's aphasia, depends on the extent of damage and on other factors. And I want to tell you again that our understanding of Broca's and Wernicke's areas is still evolving. Lots of research is going on now with functional MRIs, so we do not have to rely on brain injury cases so much. So functioning MRIs can look what the brain does and where it does it while it's doing it. So a healthy brain, not one that has suffered brain damage. Okay, so it turns out there is a lot more going on than Broca's and Wernicke's, but Broca's and Wernicke's are definitely hotbeds of language processing. Okay, so Broca's and Wernicke's are not directly next to one another on the cortex. So please look at this image here. We're looking at the left hemisphere, and you can tell because the cerebellum, the hindbrain, is underneath and in the back. You can also see the brainstem nicely here. So Broca's area is to the front of the left hemisphere in most people, and Wernicke's area is a little bit further back. So basically think of it like that. Broca's sits a little bit to the left of your left temple, up and to the left of your left temple, and Wernicke's area kind of sits above your your left ear. So in these 2 areas, and they sit on top, on the outside area, on the cortex, on the rind, the shell. They are neuron clusters on the outside of the brain. So they're not next to one another, which I always find odd, why they wouldn't be adjacent to one another, but they're not. But they obviously need to communicate with one another in order to function. So Broca's has grammar and the ability for fluent speech. Wernicke's is the area that knows how to look up meaning in the brain and how to decode the phonemes that come in. Wernicke's area is the one that can determine whether it's a p or a b or a k or a g and so on. So Wernicke's area does that kind of work. That's easier to remember if you think about Wernicke's area sitting by the ear. That's the way I remember that in the beginning. Okay, so it turns out that Wernicke's and Broca's area are connected to one another via a specialized fiber bundle. So the major fiber bundle that sits underneath the 2 hemispheres is the corpus callosum, but a smaller fiber bundle that runs within the hemisphere itself, underneath that wrinkled up area of the cortex, that fiber bundle is called the arcuate fasciculus, and I know that sounds like a mouthful, but it really just means fasciculus is the little bundle, and arcuate means arched. So it's a little arched bundle, and it sits underneath the cortex. Okay, so I have the real thing coming up, the real arcuate fasciculus. Brace yourselves, because at least I find that slightly disgusting, that image that's coming up. Here it is. Ugh. Okay, so what you see here is the arcuate fasciculus that runs underneath the cortex. So the cortex has been cut off here, and it exposes the arcuate fasciculus. It exposes other fiber bundles as well, and you can tell that we're looking at the left hemisphere. So we know from all kinds of research experiments that Broca's and Wernicke's communicate with one another extremely fast because they have their own line of communication, which is the arcuate fasciculus. Last two slides that I have for you, this one and one else coming up, and I want you to now practice recognizing either Broca's or Wernicke's aphasia. Look at these sentences. They are transcripts of real-life aphasiac statements. The first person here was asked how he was doing. It's a man, and he says, "I feel worse because I can no longer keep in mind from the mind of the mind to keep me from mind and up to the ear, which can be to find among ourselves." Very fluent, good pronunciation, good grammar. The next person says, the next person was asked what he did before he retired. And he says, "Me? Yes, sir, I'm a male demoplos on my own. I still know my tuba boys, what for I have that's gone hell, and some of them go." And the third patient was asked when he was going to come back to the hospital, when his next appointment was, and how he was going to get there. And he speaks with great difficulty, and he says, "Why, yes, Thursday. No, Friday. Barbara, wife, car, drive." Okay, guess. The first two cases are Wernicke's, and the last case is Broca's. So Wernicke's, fluent, making little sense or no sense, sometimes jargon, aphasia. Look at the second person. He says he was a male demoplos. You might think maybe that's some profession I've never heard of. It's nothing. It's a made-up word. And I still know my tuba boys. Who knows what tuba boys means to him right now? And the third person, then, the Broca's aphasiac, understands what he was asked. The other two also understand somewhat, right? So their Wernicke's is not as bad. But the Broca's aphasiac is able to answer, makes sense, but with so much difficulty. It might take 5 minutes to spit out that one sentence. That's it.